Welcome to the Healthcare Solutions Worker Orientation. Our goal today is to get you thinking about safety, because at HCS we believe that when you think safe, you work safe. So let's get started. Please listen carefully to the following safety message to familiarize yourself with the HCS health and safety requirements on every HCS construction site. HCS Health and Safety Policy. It is the policy of HCS to perform work in the safest manner possible and in accordance with the Occupational Health and Safety Act and the regulations made under the Act. HCS is committed to a health and safety program that protects its employees, contractors, subcontractors, customers, clients, the public and property from accidents and/or incidents occurring on our projects. It is the right of every worker to work in a safe and healthy work environment. The responsibility to ensure a safe and healthy workplace is every worker's responsibility. Any concerns or comments about health and safety issues should be directed immediately to the HCS site superintendent for prompt and effective action. Please take the time to read the full HCS health and safety policy that is posted on the Project Safety Board. Rights and responsibilities. Worker rights. As a worker, you have the right to know about danger. Your employer must tell you about hazardous materials or equipment used in your workplace. You should also receive training before using any such materials or equipment. Participate in making your workplace safe. You're an important part of workplace safety. Refuse unsafe work. If you believe your work is unsafe, you can refuse that work until the situation is corrected. You must, however, tell your supervisor immediately. You cannot be suspended, fired, or docked pay for refusing unsafe work. Constructor responsibilities. As the constructor, HCS needs to ensure that the measures and procedures prescribed by the Occupational Health and Safety Act and regulations for construction projects are carried out on the project. Every employer and every worker on the project complies with this act and the regulations for construction projects. The health and safety of workers on the project is protected. A health and safety representative or a joint health and safety committee is selected as prescribed. The Ministry of Labor is notified of a project specific to Ontario. The Ministry of Labor is notified of an accident or occurrence. And every contractor or subcontractor receives a list of all designated substances present at the project before the prospective contractor or subcontractor enters into a binding contract for the supply of work on the project. This means a constructor has overall responsibility for worker health and safety on a project. Worker responsibilities. As a worker, you have the responsibility to work safely at all times. Wear any protective equipment or clothing that your employer requires you to wear. Never remove a safety guard or any protective equipment. Report to your supervisor any hazard in the workplace. Report to your supervisor any violations of the law. Supervisor responsibilities. Your supervisor has the responsibility to ensure that the health and safety of workers is never in danger. Ensure that workers work safely and according to the law. Ensure that workers use and wear any protective equipment or clothing as required by the law or the employer. Advise workers of any possible danger to their health or safety on the job site. General safety rules. Work safe. Make sure that you sign in every time you arrive on site and sign out every time you leave site. Never do a job that you are not qualified to do. A clean job site is a safe job site. Never run a piece of machinery you are not trained to operate. Always ask your supervisor if you are not sure how to do a job. Do the job right, not the quickest way you can think of. Watch out for other people and machinery. Recognize and correct and report hazards. Wear your personal protective equipment. Obey the safety rules of our customers. They are in place for a reason. Your safety. Make suggestions to your supervisor on how to make your job a safer place to work. Get the correct training. Everyone is responsible for safety. You are responsible to receive a site safety orientation. Follow all company safety policies and procedures at all time. Report all accidents, including unsafe acts, unsafe conditions, and near-miss incidents. Keep the construction site and storage areas clean and clear of obstruction at all times. Dispose of waste in the appropriate containers. Record all injuries, regardless of how minor the injury may appear. Ensure that all exits and doorways are kept clear at all times. Clean up spills promptly and properly. Use tools and equipment according to directions provided by the equipment manufacturer. Operate all vehicles and mobile equipment in accordance with site rules and highway regulations. Know and use the policies and procedures associated with WHMIs and TDG. Healthcare Solutions Policies. Disciplinary Policy. All safety rules and procedures contained in the Healthcare Solutions Health and Safety Program shall be practiced and enforced by all personnel in order to maintain a safe and healthy work environment. Compliance with this program, the Workers' Compensation Boards, and any other applicable federal, provincial, or local rules and regulations are mandatory. As with any program, corrective disciplinary measures may be required in order to deal with non-compliance. Actions of a hazardous nature or that have been deemed to be in non-compliance with the HCS company rules and regulations will result in a corrective action being issued with the following disciplinary actions. Minor infractions. Definition. Any infraction of government, corporate, or client rules that does not have the potential to cause serious damage or injury. First offense. Verbal warning. Second offense. Written warning, corrective action. Third offense. Suspended from site until further notice. Fourth offense. Banned from all job sites. Major infractions. Definition. Any infraction of government, corporate, or client rules or legislation that does have the potential to cause serious damage or injury. First offense. Written warning, corrective action. Second offense. Suspended from site until further notice. Third offense. Banned from all job sites. Orientation policy. All on-site workers and visitors must receive a general health and safety orientation before commencement of work. The objective of the orientation program is to provide all on-site workers and visitors with consistent safety information. Each person must know and understand their job-related activities, duties, and responsibilities prior to commencement of work. The orientation provides the opportunity for your site superintendent to advise you of any existing or potential hazards that exist on the site. If any worker is in doubt concerning any part of the orientation, their safety rules, or responsibilities, they should contact their respective first-line supervisor for clarification before undertaking or continuing any work-related activities. Note: all personnel will be required to complete the acknowledgement form upon completion of the health and safety orientation to attest that they understand and agree to abide with the safety program and that they have attended the worker orientation. Site dress code policy. Workers and visitors to a Healthcare Solutions job site must wear the proper attire to be allowed on site. The following rules are intended to protect individuals from the dangers of the construction site. Clothing. Workers are to wear either short-sleeve or long-sleeve shirts. No sleeveless attire is allowed. If workers wear long-sleeve shirt, they must fit snugly and not be baggy in any way. Workers and visitors must also wear long pants versus shorts, dresses, or skirts. Workers' clothing should not be cut off, tattered, or display any wording that is or may be taken as offensive. The clothing should be clean and not contain dirt or dust from the construction site, as this may affect the quality of our infection prevention and control measures. Personal protective equipment. Workers and visitors are to wear hard hats at all times. Steel-toed safety boots or shoes are required at all times. All footwear must be CSA approved. Eye protection is to be worn at all times. Hearing protection and gloves are to be available at all times and worn as needed. PPE is to be brought to the site by each individual and worn as required. Infection prevention and control. You may be required to wear the following contractor-supplied items as well: Tyvek suits, dust masks, disposable shoe boot covers, safety harnesses, and lanyards. A worker must wear a safety harness with the lanyard tied off to either a fixed support or a lifeline whenever the worker is 3 meters 10 feet or more above the ground, above operating machinery, or above hazardous substances or objects. All safety harnesses and lanyards must be CSA certified. Both the harness and lanyard will carry a CSA label. Safety harnesses must be snug-fitting and worn with all hardware and straps intact and properly fastened. Lanyards must be 15 millimeters, 5/8 diameter nylon or equivalent. The lanyard should be secured to a rigid support or lifeline, preferably higher than waist level, and be kept as short as possible to facilitate job duties. When the lanyard is wire rope or nylon webbing, a shock absorber must be used. Workplace violence and harassment policy. Healthcare Solutions is committed to providing a safe, healthy, and supportive work environment by treating our employees, subcontractors, and clients with respect, fairness, and sensitivity. Violence and harassment in the workplace can have devastating effects on employees' quality of life and organizational productivity. Workplace violence is defined as the exercise of physical force by a person against a worker in a workplace that causes or could cause physical injury to the worker, an attempt to exercise physical force against a worker in a workplace that could cause physical injury to the worker, or a statement or behavior that it is reasonable for a worker to interpret as a threat to exercise physical force against a worker in a workplace that could cause physical injury to the worker. Workplace harassment means engaging in a course of vexatious comment or conduct against a worker in a workplace that is known or ought reasonably to be known to be unwelcome. Violent behavior in the workplace is unacceptable from anyone. Everyone is expected to uphold this policy and to work together to prevent workplace violence. We will take whatever steps are reasonable to protect our workers from workplace violence or harassment from all sources. All workers are encouraged to raise any concerns about workplace violence or harassment and to report any occurrences to your supervisor. Management pledges to investigate and deal with all incidents and complaints of workplace violence in a fair and timely manner, respecting the privacy of all concerned as much as possible. Alcohol and drug policy. To minimize the risk of unsafe and unsatisfactory performance due to alcohol or drugs, workers are expected to report fit for work and remain fit for work throughout their workday or shift. The following are expressly prohibited while on an HCS site: the use, possession, distribution, and offering for sale of drugs or drug paraphernalia. The unauthorized use, possession, distribution, offering for sale of beverage alcohol. Possession of prescribed medications not authorized for personal use. Reporting for duty with the presence in the body of alcohol or drugs above the accepted standards. Disciplinary action up to and including being banned from site will be taken for violations of this policy and its related practices. Smoking policy. Healthcare Solutions is committed to providing a healthy, comfortable, and productive work environment for our employees and the community. In order to eliminate hazards and ensure a safe, healthy worksite, HCS will protect the health of all by prohibiting smoking in all enclosed workplaces and enclosed public places. All forms of tobacco use will be prohibited within Healthcare Solutions buildings and temporary locations, including, but not limited to, offices, worksites, and all enclosed facilities. Additionally, the HCS smoking policy shall respect the smoking policies of all facilities where we are providing construction services. If the facility's policy prohibits smoking anywhere on the premises or has designated smoking areas, then HCS will enforce that policy. This policy applies to all employees, clients, contractors, and visitors. Infection prevention and control, commonly known as IPAC. Infection control. What is CSA Z317.1322? It is a Canadian standard for infection control during healthcare facility construction, renovation, and maintenance. It ensures the protection of patients, staff, and workers from healthcare-associated infections. Why it matters. Healthcare environments are sensitive to contaminants and disruptions, and adherence to this standard is critical for patient safety, compliance, and project success. Patient and worker safety. It prevents the spread of airborne contaminants, dust, and biological hazards. It protects immunocompromised patients from exposures. Regulatory and legal compliance. Following CSA Z 317.1.322 ensures adherence to healthcare regulations and avoids penalties. It ensures compliance with hospital policies and provincial health standards. Infection control also promotes project success and efficiency. It prevents costly shutdowns, delays, and rework due to non-compliance. And it helps maintain good relationships with healthcare clients and stakeholders. What are the infection control measures that are required? Risk assessment and planning. All work must be classified under infection control risk assessment, ICRA levels. Barriers and containment. HEPA filters, negative air machines, and temporary barriers must be installed when necessary. Dust and debris control. Requires proper methods for dust suppression and controlled demolition processes. Worker protection. PPE requirements, designated work zones, and proper disposal of materials. Air quality management. Managing air pressure differentials to prevent the spread of contaminants. What are the roles and responsibilities of subcontractors under infection control measures? Understand and comply with infection control requirements. Follow all site-specific safety protocols. Attend pre-job orientation and training. Learn about specific infection control procedures required on site. Use proper equipment and techniques. Ensure tools and materials meet CSA standards for dust and contamination control. Report issues and maintain documentation. Communicate any safety concerns or breaches in containment immediately. What are the consequences of non-compliance? Project delays and shutdowns. As non-compliance can lead to work stoppages and long, costly delays. Health risks and liability issues. As exposure of vulnerable patients to contaminants can cause a risk to their health and open us up to major liabilities. Loss of future work and reputation damage. Hospitals and healthcare facilities expect high standards. Failure to comply can result in contract loss. Commitment to compliance. Our expectation. Every subcontractor must adhere to CSA Z 317.13-22 guidelines and site-specific infection control plans at all times. Investigations and reporting. Injury and incident reporting. The main purpose of accident incident investigation and reporting is prevention. Finding the cause and attributing factors of an accident or incident and taking steps to control or eliminate those causes can help prevent similar accidents from happening in the future. Healthcare Solutions requires all workers to immediately report all accidents and incidents that result in injury or property damage, and all near misses with the potential for serious injury or property damage to the HCS site supervisor. Supervisors will report the accident promptly to management to ensure timely response for corrective action and submission to the appropriate workers' compensation board, if required. Each incident will be analyzed to determine causes and contributing factors, and the analysis will be used to reduce or eliminate the risk of further incident. The following definitions will help us define what reporting is required and when. An incident is an unplanned, undesired event that hinders completion of a task and may cause injury, illness, or property damage, or some combination of all three, in varying degrees from minor to catastrophic. Unplanned and undesired do not mean unable to prevent. Unplanned and undesired also do not mean unable to prepare for. A near miss is a subset of incidents that could have resulted in injury, illness, or property damage if given a different set of circumstances, but didn't. Near misses are also known as close calls. An accident. This definition is often similar to incident, but supports the mindset that it could not have been prevented. An accident is the opposite of the fundamental intentions of a safety program, which is to find hazards, fix hazard, and prevent incidents. When we accept that accidents have no cause, we assume that they will happen again. When a worker reports a work-related accident or incident, the HCS site supervisor will do the following: administer first aid as required, arrange for transportation and accompaniment for the injured worker to a medical treatment facility if required, eliminate the hazard if possible, or guard the accident scene if the worker is critically injured, advise management by telephone of the accident or incident, investigate the cause of the accident and report findings in the HCS accident incident report, ensure all areas of the form are completed and photographs taken, send a copy of the report to the appropriate people. The report will define all incidents as one of the following: lost time injuries, medical aid, first aid, incidents, and near misses. What is a JSA? A job safety analysis. JSA is a systematic process used to identify and mitigate hazards associated with specific job tasks or activities. This can also be referred to as a JHA, job hazard analysis. The purpose of the JSA is to ensure worker safety by evaluating risks and implementing control measures before work begins. Why is a JSA important? It enhances safety and health on the job site, reduces the likelihood of accidents and injuries, ensures that hazards and risks on the project are communicated to all workers, ensures compliance with all safety standards and regulations. When to use a JSA? Prior to the start of any new project, task, or job. When introducing new equipment or procedures. Prior to starting any high-risk work such as power tie-ins or rigging. After an accident or near miss to prevent recurrence. We will review how to complete a job safety analysis. For the purpose of this demonstration, we will use the HCS JSA. First, you need to identify the project you are on, the company filling out the JSA, and the date it is being completed. Next, add the name of the foreman completing the JSA and the time of completion. In the next section, provide a description of the planned tasks for the day. In this case, delivering and installing drywall. Before we move on, you will need to identify any critical or high-risk tasks that may be involved in your work, such as working from heights or confined space. This job does not have any tasks that would be considered high risk. Moving on to the hazard assessment section, you will start by identifying each job task that will be undertaken by your team during the shift. Examples include lifting drywall, transporting it to the room, fitting and cutting drywall, and hanging the drywall. Now you need to take a moment to identify potential risks or hazards that may arise while completing these tasks. Examples include lifting heavy drywall causes strain on the worker, damage to the drywall or the building as you transport it through the hospital to the job site, cutting drywall, posing a risk to cuts to workers, and then once again lifting the drywall into place. Now you are ready to assess the risks and any consequences that may occur when completing each task. In our case, consequences include things like strain injuries due to heavy lifting, cuts due to drywall cutting, and damage to property. Once you have assessed the risks and consequences, you need to identify the control measures to either minimize or eliminate the risks to the workers. Our drywall team's controls may include ensuring proper lifting techniques. Use a two-man team. Ensure a drywall cart is used to transport the material through the facility and that the drywall is properly secured, and be aware of your surroundings at all times. Ensure you place the drywall on a flat surface for cutting and wear gloves when cutting. And again, ensure proper lifting techniques are used when installing drywall. Consider using a lift. Finally, make sure that your tools are easily accessible to secure the drywall in place to minimize the length of time it needs to be held. Proper PPE is the final step in hazard controls and includes hard hats, safety boots, safety glasses, as well as any task-specific protection that may be required, in this case, gloves. Next, you need to officially assign responsibilities for the indicated controls. Each worker on your team needs to be responsible for the safety of your work. Therefore, each worker needs to be named on your JSA. Once you have taken the time to review and discuss the JSA with your workers, and they have agreed that the potential risks have all been accounted for, and that the proper control measures are in place, they are to initial their acceptance next to their name. If additional controls are required, please identify them prior to sign off. Each JSA should have a priority ranking assigned to it to allow the site superintendent to easily identify high-risk activities. We will review this on the next slide. Finally, we need to ensure that all risks and controls are communicated properly to the rest of the worksite. In order to do this, the foreman will review the completed JSA with the HCS site superintendent. If the HCS site super is satisfied with your JSA, both the site super and the foreman will sign off on the JSA. The site super will also take this time to confirm that each of your workers has completed the HCS worker orientation prior to the start of today's work. The HCS site super will now use this JSA to communicate any risks or hazards that are created by your work to the other contractors on site to ensure that everyone is able to work safely together. Using the risk matrix. What is a risk matrix? A risk matrix is a tool used to evaluate and prioritize risks based on their level of exposure and severity. It helps determine the level of risk and guides decision-making for implementing control measures. How to use the risk matrix. 1. Determine level of exposure and severity. Level of exposure. Assess how probable it is that the hazard will cause harm, e.g., unlikely, seldom, occasionally, likely, frequently. Severity. Evaluate the potential impact of the hazard if it occurs, e.g., negligible, minor, serious, major. 2. Plot risks on the matrix. Using the HCS hazard priority ranking matrix, plot the level of exposure on one axis and severity on the other. Record the risk level noted where they intersect, e.g., M3. 3. Assess risk levels. The intersection of level of exposure and severity indicates the risk level, e.g., low, moderate, high, extreme. High and extreme risks require immediate attention and robust control measures. 4. Prioritize control measures. Focus on addressing hazards with high or extreme levels first. Implement control measures that are proportional to the risk level to effectively reduce the risk. And 5. Review and reassess. Regularly review and update the risk matrix as work conditions or procedures change. Reassess risks after implementing control measures to ensure they are effective. Shutdown requirements. Work that will affect any area of the facility that is outside of our site must be planned in advance, and proper facility-specific forms are to be completed, submitted, and approved prior to proceeding with the work. Electrical shutdowns, fire alarm bypass, mechanical shutdowns are all examples of work that will require planning and approval prior to work proceeding on site. Electrical safety. Only trained qualified workers are permitted to perform work involving electrical equipment, and they must follow all OHSA and electrical safety code requirements at all times. Fire safety. All fires are to be treated as emergencies. Properly trained workers and/or the HCS site super can respond to localized fires. Upon discovering a fire, evaluate the severity of the fire. Notify the HCS site supervisor, who will attempt to extinguish the fire if possible. Where there is a large fire, the fire department shall be notified immediately by calling 911 and pulling the closest fire alarm. Alert others in the work area of the fire and follow the posted evacuation route to the predetermined muster station. Ladder safety. Following ladder safety regulations is essential for minimizing risks and protecting workers. Inspection before use. Inspect ladders before each use to ensure they are free from damage such as broken rungs or loose components. Ladders must have non-slip feet and be positioned on a firm level surface. Choosing the right ladder for the job. Ladder type. Ensure you select a ladder that is appropriate for the job. Use non-conductive ladders, e.g. fiberglass, when working near electrical sources. Height requirements. The ladder should extend at least 1 meter above the working surface and be tall enough to avoid standing on the top 2 rungs. Weight capacity. Check the ladder's load rating. Ensure it can safely support your weight and any tools or materials you'll be using. Environment considerations. Use ladders designed for specific conditions, e.g. wet environments, industrial settings. Avoid metal ladders near power lines and live magnets. Proper setup. Ensure your stepladder is fully opened and the side rails are fully extended and the spreaders are locked in place. Ensure the ground is level, stable, and free of debris. Ensure the ladder is placed at the correct angle. The horizontal distance from the base to the wall should be 1/4 of the ladder's length. Secure the ladder at both the top and bottom to prevent movement. If securing is not possible, have another worker hold the ladder. Ensure the ladder is not placed behind a door that can be opened by others. Climbing and descending. Always maintain 3-point contact, 2 hands and 1 foot, or 2 feet and 1 hand on the ladder at all times. Face the ladder while climbing or descending and avoid carrying tools in hand. Use a tool belt instead. Safe use practices. Only one person should be on the ladder at a time. Never lean or overreach beyond the side rails. Move the ladder as needed to avoid stretching. Metal ladders must never be used near power sources due to the risk of electrocution. Fall prevention. Where ladders exceed 6 meters or are near traffic, additional fall protection or worker support is required. RFI process. RFIs or requests for information are to be discussed on-site with the HCS site superintendent prior to any escalation. If no decisions or solutions can be found or additional information is required, the HCS site superintendent will submit an RFI to the HCS project manager. If the HCS project manager cannot provide an immediate response, a formal RFI will be issued to the consultant or the facility. Their response will be provided back to HCS. HCS will then distribute the final RFI response to the project team. Note: no RFI is to be issued directly to a consultant or the owner by a subcontractor. Verification code. Please provide the following code word to the HCS site superintendent to verify that you have watched the worker orientation video and agree to comply with all HCS health and safety rules and requirements. Congratulations! You have completed the online portion of your worker orientation.